Now we start scanning the pelvis of male. Here we see the urinary bladder. The urinary bladder is partially filled but appears to be normal. At right side of urinary bladder, we see a free fluid. Also we see echogenic debris in the fluid. These are gut loops floating in the fluid. The peristalsis in the gut loops appears to be normal. Here also we see the blood vessel. These are common femoral vein and artery. Now from suprapubic we start slowly sliding to the right iliac region. This is distal ileum, which is also prominent, and gases are appears to be absent. Now slowly sliding to the right iliac region to locate the ileocecal junction. The gut tubes are prominent with less gases and food particles seen. Now at this part of gut we see the peristalsis is increase. The walls of gut loops are mildly prominent but not inflamed. These are visible due to absent gases. Here we see the distal ileum joining with the cecum. This part of distal ileum is more prominent and the walls are mildly inflamed. Here we see the cecum which contain gases in bubble shape. The walls of cecums are also mildly prominent and inflamed. Here we are scanning the appendix by fixing a probe at this point and will tilt up and down side to search the right iliac region. This is cross-section view of cecum, and here we see at left side distal ileum and at right side we see a small ring-like structure. This could be appendix. Now we're rotating the probe at its axis to form the lumen of this ring. Here we see the lumen of appendix, which lies at right lateral side of the cecum. There is no peristalsis in the lumen, but we see gases and Gangrenous fluid. The walls of appendix are inflamed that are not clearly visible. The air and Gangrenous fluid in the appendix shows that the appendix is gangrenous. This is distal end of the appendix. And here we see the collection at peripendicular area. Now we will measure the anterior posterior diameter of appendix. The anterior posterior diameter of appendix is 8.9 millimeter. This is proximal part of ascending colon, which contain gases and appears to be normal. Now how we will write report?